State House actually passed a bill that would commit Vermont to establishing healthcare as a public good for all, equitably and publicly financed, that would provide healthcare to all Vermonters as a fundamental right. And that piece of legislation is still on the books, unfortunately, because of various political issues over the past several years. It has not been realized and implemented. And we at Rights and Democracy believe it should. We fundamentally believe that healthcare is a human right and that it is something that makes sense for our communities, for our economy, for our state, for every Vermonter to get the healthcare that they need when they need it, regardless of ability to pay or other socioeconomic or demographic factors. I'm a nurse, and I feel very passionate about this because of the personal experiences I have every week with my patients whose health and quality of life is compromised because of their lack of access to needed medical care. So it really is a human rights issue. It is an issue about building sustainably healthy communities. And there's now in this political moment, even though historically we've been waging this fight for years, there's even greater urgency in our state because at the national level with the Trump administration and the Republican-controlled Congress, healthcare is under attack more than ever, not just with the efforts to repeal the Affordable Care Act, otherwise known as Obamacare, but also with the efforts to fundamentally dismantle Medicaid and eventually Medicare as we know it, which will have a devastating impact on thousands of Vermonters and millions of Americans. So the fight is here. The fight is now. We need to engage. We need to mobilize. We need to share our stories. And that's what we're doing here at Rights and Democracy.
Great. Yeah, thank you. So you had mentioned the kind of national level, the healthcare fight right now. And so I guess, is there any, like why should we as Vermonters care about the Republican kind of healthcare agenda?
That's a great question. And there's lots of different answers. I think a major one is that the plans, the American Health Care Act, which passed 2 weeks ago in the House and has now moved into the Senate, is a bill that would fundamentally restructure our healthcare system. It would repeal key protections and gains made under the Affordable Care Act, which, we recognize was not a perfect bill. It is not single payer. It is not universal health care. It still, heavily relies on the for-profit health insurance industry to provide access. However, there were serious gains made in terms of provisions that protect people with pre-existing conditions, that mandate coverage of essential health benefits, including maternity care, preventive screenings for things like colonoscopies and mammography, and other really fundamental healthcare services. In addition to expanding Medicaid to cover lower income adults who otherwise, previous to the Affordable Care Act, were largely left out and uninsured or underinsured in our healthcare system at the national and state level. And so in addition to repealing and potentially threatening all those gains, the bill also goes after traditional Medicaid as we know it. The plan would cut about $800 billion or more from Medicaid nationally, which would have tremendous economic fallout for our state. Medicaid, as a proportion of federal funds that this state receives, is by far the largest percentage of federal funding. The state stands to lose hundreds of millions of dollars if the GOP bill, as it came out of the House, were to pass in the Senate. And that has a tremendous impact both on those folks who gain coverage via the ACA, either through subsidies on the exchange or through the expansion of Medicaid, and also for those Vermonters who are Medicaid beneficiaries, traditional Medicaid beneficiaries even before the expansion happened. And I think it's really important to highlight, there's a lot of misunderstanding about the Medicaid program. It is not just a program that serves lower income people. It also serves about 50% of Vermont's children. At the national level, it covers 50% of all births. It covers 75% of family planning services and 50% of all long-term care. So we all know folks that live in nursing homes, or we have relatives or friends that have family and loved ones in nursing homes, and Medicaid is by far the biggest payer for those services. So this bill would be a tremendous hit on seniors, on women, on children, and on lower income families and individuals in this state. So your question is a really important one. There's a lot of national numbers that get thrown out on there, but there's a real face to this fight in Vermont, and it's the face of our elderly loved ones. It's the face of single mothers. It's the face of folks with substance abuse issues who are trying to recover and are now eligible for more care and services because of the Medicaid expansion or because of the increased funding that came through the ACA for mental health and substance abuse treatment, just to name a few. So it's a real problem with a real face here in Vermont. And those Vermonters are telling their stories. And we've gotten a lot of them, and I see their stories every day, both in talking to people in my role as a rights and democracy healthcare organizer, but also very much so in my role as a nurse dealing with patients on a weekly basis.
Great. Yeah. So, I mean, this is an issue that affects every Vermonter, and thousands directly. And it sounds like overwhelmingly Vermonters want to see a universal healthcare system implemented. So I guess my next question would be what's the holdup on implementing the system, and what can people do to make sure that this is something that is on the table, especially with the governor?
Another really great question. I think the major overarching holdup is that people in power and people with money stand to lose, right? The healthcare system is incredibly dysfunctional and creates a whole sort of second-class healthcare citizenry, both in Vermont and throughout the country, as a for-profit system in which the real determinant of how care is delivered is profits and not actual health and public health outcomes for individual patients and whole communities. However, despite the fact that that's a disservice to the vast majority of Vermonters in terms of their medical well-being and their quality of life, it is serving some people. And those people are private insurance companies and big pharma. And unfortunately, those people have a lot of political power and clout and money, and they use it. And so that's probably the biggest factor in why, we've had a law on the books since 2011 that puts us on a path to universal publicly financed healthcare as a human right and public good, but it hasn't been implemented because there just hasn't been the political will in the State House to make it happen. So that's one big factor. That's sort of a common factor. That's Bernie's refrain. We got to get money out of politics. We got to get people power in instead. And that's, again, what we're doing here with Rights and Democracy. But I think also currently we have a governor who has not publicly stood up for Vermonters' healthcare in the way that we feel like he should be, given the national assault on basically healthcare for lower income people, for seniors, and for all those groups that I just discussed. And if we don't have leadership in the governor's office to stand with Vermonters, that's a big block and barrier to us moving forward with innovative state solutions to improve access to high quality care. And so we here at Rights and Democracy have been pressuring Governor Scott, both through a petition letter, which we sent a couple of months ago that's gained over 3,000 signatures just in probably about 2 months. And now a new letter post passage of the American Health Care Act, again asking him to stand up with even greater urgency now that we know that this really disastrous bill has passed in the House and is moving into the Senate. And we've been collecting healthcare stories from Vermonters who are really dismayed at the governor's lack of a firm stance to stand with them to protect their healthcare. And we've shared those stories with him. So we just need to keep mobilizing. We need to keep, getting people's healthcare stories out there, both for the governor, but also to educate our fellow Vermonters and get the media to pay a little more attention to the gravity and seriousness of this fight and what this state's economy and communities and people stand to lose if our healthcare system is fundamentally undermined by anything that happens at the national level. So there are barriers, but we firmly believe that if we can get the story out there, if we can get Vermonters' voices heard, we can move elected officials, and we can counterbalance the significant money and corporate political power that has a vested interest in the status quo and maintaining a broken healthcare system.
So it sounds like, people who have a compelling healthcare story, or, just people who stand to lose their healthcare under the American Health Care Act, a way to pressure Phil Scott would be to write that down and share it.
Yes, share it. Please do. On our website, we have a page where you can share your healthcare story. We still have the petition to Phil Scott going, and I would invite you to check that out on our website as well. And please sign that. Please share it on your social networks. Please urge others to also sign it. This is something I think we all need to be talking about in our communities, with our families, with our friends, with our neighbors. The specific links for the petition are radvt.org/DearPhilScott. And then you can also share your healthcare story at radvt.org/healthcarestory. And when I say healthcare story, it doesn't have to be that you have some, very dramatic patient experience. We all are connected to the healthcare system in some way. We all are patients either currently or will be in the future, or we have loved ones. And it's really just a forum for you to share how you feel like this healthcare debate and the current system impacts you and your family, and what you would like our elected officials to hear, because that's who we're sharing this with. We're going to be sharing your stories with the media and with the folks in power at the State House, so that we can start to really build the overwhelming political pressure that will be enough to overcome, the entrenched, well-moneyed powers that have historically fought us making real improvements in healthcare in Vermont.
Yeah. And I just want to, commend your point about the way that we're actually going to create change is by lifting up our voices and sharing our stories. And we need, all of us who have these values and who have stories to be contributing that to this fight. So thank you. So now we're going to open it up to audience questions. So if you have a question over the phone, feel free to just ask if there's a quiet moment. And otherwise, we have a couple in chat as well. Great. Well, one question that we have through our chat window is, as we as a state and even nationally struggle to have our healthcare needs protected, are there alternative community-based or even business initiatives that we can support in order to begin building sustainable community healthcare?
So I guess that question, so I think there are local solutions. I think we've seen them. I think one prime example would be the most recent effort in this state to passed something called universal primary care, which would essentially create a universal system of free primary care for all ages. So it would essentially expand Medicaid and Medicare essentially for the provision of primary care services, which are things that basically primary care encompasses going to the doctor or a nurse practitioner, or going to a walk-in clinic. And so it's the management of most healthcare issues at the non-inpatient, non-hospital level. Things like well checkups, immunizations, all the slew of pediatric schedule of visits that children get from birth into their teens. And so it's a substantial portion of healthcare, and it can be delivered very cost effectively, and saves healthcare costs, because the idea is if we manage people's chronic conditions and healthcare issues before they get so complex and so serious that they require hospitalization, we're saving a lot of money. For example, it's a lot easier to manage diabetes with the first line medication called metformin, which is generically available, and diet and exercise in a primary care clinic, than to wait until someone's diabetes has gotten so bad that they need their foot amputated in the hospital in a surgical center.
Right.
And so that was an effort that unfortunately did not pass out of the Senate Health and Welfare Committee this past winter. And that was something that a lot of RAD members supported, and we are going to continue to push for if it were to come out next session. So there are local solutions like that we can support and get behind, and we will continue to do so. It's just very important that we always do that with an eye towards the end goal of essentially Act 48. Universal primary care would be a significant step in the right direction, but we believe in essentially Medicare for all, what Bernie is fighting for at the national level, and what we are fighting for here in this state is access to all healthcare services at every level, whether primary care or hospital, regardless of ability to pay, because it is a fundamental human right, as we spoke about. So we will continue to mobilize for local innovations as we also continue to wage the fight at the national level against the attacks on Vermonters' healthcare.
Great. Well, thank you so much, Jess, for being here. And thank you, everyone, for taking part in this call and for your great questions. We're going to be posting the information about tonight's call, including names, emails, phone numbers, and websites that we mentioned this evening. And we'll be posting all of that information to our website at radvt.org.
And Elise, if I can just interrupt aside, and one more thing. One thing to check out is we do also have an upcoming event down in Bennington. RAD members in Bennington have organized a May 26th, Friday evening healthcare rally. So if you know folks in that neck of the woods, or you are down in that area, or you want to do a Memorial Day holiday road trip, head down and raise up your voice and get to know some wonderful speakers and other activists and organizers on the healthcare issue, and really start building this movement.
Great. Fabulous. So we hope that you can join us next Tuesday, May 23rd. If you have a topic you'd like us to focus on, email me at elise@radvt.org. And you can also check that out for staying updated on our work. Thanks so much.
Thank you.